May I please have your first name?
So it's Diana.
Diana. And date of birth, Diana?
November 23rd, 2000.
2000, okay. So I see you've been seen by me more than 6 months ago for a head-to-toe assessment, which was positive. So tell me what brings you in today.
I do feel some kind of stomach pain.
Tummy pain, okay.
Yes, it comes and goes a lot more often.
Comes and goes.
And the headache.
Okay, have you made any changes to your diet?
No. I've been eating regularly, same things. I have noticed when I eat eggs, it does tend to get a little worse.
Oh, okay, so eggs exacerbate the pain. Okay. On a scale of 1 to 10, in how much pain are you right now?
I would say it's at like a 4.
A 4.
4, maybe almost a 5, but 4.
Any other pain anywhere else in your body?
I do have a slight pain in my chest. It came like last week. It went away, but I feel like it might come back.
Okay, you're afraid it could come back. And can you describe this pain? Was it a dull pain or was it sharp and stabbing?
It's kind of like a sharp pain.
Okay. And can you point to where?
It's just like in here.
In the middle of the chest, okay. Alright, so what I'm going to do today is perform a neurological assessment to make sure that, all 12 of your cranial nerves work as expected. Then I'll focus on doing a cardiovascular examination to check out your heart and try to understand where the chest pain may be coming from. And then I'll also focus on your tummy as well. Okay. So I'm going to go ahead and sanitize my hands first. Alright, I'm going to start by focusing on just your vital signs, right? To have a good baseline. So I'll take your temperature. Just going to go over your forehead. Alright, and behind the ear. 98.2, so that's very good. No temperature, no fever. Have you had any colds, any, flu-like symptoms in the last 4 weeks?
I haven't, but I have had like a slight cough.
A slight cough, okay. For how long?
So I had pneumonia a couple months ago, and
Okay.
I feel like my cough kind of leaves and comes back a little more often than not, but it's coming back just like, so I feel like that might be
connected to the chest pain, that's for sure. It still doesn't explain the tummy pain, but that could be a secondary symptom. So yeah, let's go ahead and focus on your heart in a bit. So if I may have your finger, let's check the level of oxygenation. That did not want to take. Right, so I'm seeing 98% oxygenation and about 80 beats per minute for your heart. So as of right now, your heart is okay.
That's good.
Okay. So I'm going to just palpate your head and check for any neurological symptoms you may be experiencing while I'm touching your head. So let me know if you feel any pain. Any pain when I'm pressing down on your mastoid bone process behind your ear?
I feel slight pain on the right.
Okay. On a scale of 1 to 10?
I would say it's a 1.
A 1, okay. So I'm definitely gonna check out the ear. Not feeling any lumps or bumps. Any pain at the top of your spine here?
No.
Okay. Do you feel this equally on both sides of your forehead?
Mm-hmm.
Equally on both sides of your cheeks?
Mm-hmm.
And equally on both sides of your jawline?
Mm-hmm.
Very good. Just checking for lymph node enlargement. I'm not feeling any. I'm gonna take a look at your thyroid gland and palpate. Okay, no enlargement of the neck. Thyroid gland is barely palpable. Can you swallow for me? Moves up and down as expected. Gonna feel it from behind as well. Okay, swallow again for me. Perfect. Okay. So let's take a look at your right here to make sure that there are no infections.
Mm-hmm.
Tympanic membrane is pearly gray. No wax built up, no discharge. That looks perfect. Alright, let's take a look at this other ear as well. Pearly gray tympanic membrane, well-defined margins. No discharge or wax buildup. No signs of cerebral fluid. Okay, perfect. So your ears are looking okay.
Mm-hmm.
I'm going to go ahead and take your blood pressure next, and then we'll focus on your heart and your tummy.
Okay.
All right. Is this arm okay?
Mm-hmm.
If you could hold this for me. And slide your arm right in between mine. Come on, 20 over 80. So that's within normal limits. Your vital signs are okay.
Yeah.
Right, I'm going to go ahead and focus on your 12 cranial nerves next. Go ahead and give me a big wide smile. Okay, very good. Any pain here?
Mm-mm.
Good. And now frown. Okay, very good. Any pain here when I do this?
Mm-mm.
Okay. Now puff out your cheeks and keep them puffed. Don't let me unpuff them. Okay, that's good resistance. Now raise your eyebrows and keep them raised. Don't let me lower them. Good. And I'm going to attempt to move your head side to side. Don't let me do that, so look straight and try to resist my motion. That's one, that's good. Very good. Shrug your shoulders up for me. Good. And now hold my arms and squeeze my arm. Good, strong muscles. And spread out your fingers. Good. Just going to take a look at your hand. No signs of any palmar erythema. Okay, this looks good as well. Let's check your capillary refills. With within 2 seconds. That's normal. And over on this arm, 2 seconds, normal. Good. And continue spreading your fingers out. And I'm going to attempt to bring them together, so don't let me do that. Okay, perfect. Good. So you have some very good muscles in your fingers. And I'll do the okay sign like this. And I'm going to attempt to pull through. Don't let me do that. Good, resist. Perfect. All right, Diana. Go ahead and lay down and let's take a look at your heart, lungs, and your tummy. Okay. All right, Diana, are you comfy? Okay. I'm going to go ahead and auscultate your heart, your lungs, and then your tummy. Okay, just breathe normally for now. Good, I'm hearing normal sounds. I'm going to listen at the bell side as well. I'm looking for any murmurs, bruits, crackling. The heart is normal. Take a deep breath in and out. Okay. Going to listen to your lungs next. Just continue breathing deeply. Good. No crackling, no signs of bronchitis or pneumonia.
Sorry, I'm a bit hungry.
It's okay. I'm going to listen to the carotid artery as well on the neck. Good. So no abnormal sounds. I'd like to make sure that the sensitivity on your chest and neck is as expected. So I'm going to do a series of sensory tests. The first one is called sharp or dull. So this is what dull feels like. And this is sharp, as well as this is sharp.
Okay.
So go ahead and tell me, which one do you feel, sharp or dull?
Dull.
Good.
Dull. Sharp.
Good.
Sharp. 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 Dull. Sharp. Sharp. Dull. Sharp. 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 Dull. Sharp.
Very good. Now, next up, I have here slightly sharper tool. It's a pinwheel, and it has 2 wheels. This is what 1 wheel feels like, and this is what 2 wheel feel like. So go ahead and tell me if I'm touching you with 1 or 2. Okay.
1,
2. Good.
1, 1, 2.
Very good.
2, 1, 2, 1, 2, 2, 2, 1. Very good.
Next up, I'm going to cause a vibration with this tool, and I'm going to place it on your chest. Just say yes when you feel it.
Okay.
I feel it. Okay.
Yes.
Good. Yes. Yes. Yes.
Yes.
Yes.
Yes.
Very good. I have here a device that's cold, and this is what cold feels like. And another device that's sharp. This is what it feels like. Go ahead and tell me if you feel cold or sharp.
Okay. Cold, sharp, cold, sharp, cold, sharp, sharp, cold, 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 sharp, cold, sharp, cold.
Good. Okay, just say yes when you feel me touching you with a sharp object.
Yes.
Yes. Yes. Yes. Yes.
Yes.
Yes.
Yes.
Yes.
Yes.
Yes. Yes. Good. Just going to inspect your chest next with the UV light to see if I can detect any micro lesions or any abnormalities of the skin.
Okay.
Gonna take a look at your face as well. Just see if I can spot anything that just may be an external sign on the skin. Not seeing anything abnormal. Alright. So next up I'm going to focus on your abdominal area. Is it okay if I lower the mat a little bit? Okay, so my stethoscope is going to go on your abdomen next. It's a little cold, so I do apologize.
It's okay.
Trying to warm it up a little bit. Okay, just breathe normally. I'm just checking for normal gastrointestinal activity in all 4 quadrants of the abdomen. I'm not hearing any swooshing, just a normal activity. No gurgling. Well, some minimum gurgling as expected. Heard the sound, which is good. We do want some activity in the abdominal area. Okay, very good. Next up, I'm going to do a light palpation. I'm gonna just place my stethoscope right there, and I'm gonna get a little bit of oil. I'm just looking for any masses, any swelling that's abnormal, any pain or tenderness that you may be feeling. Okay. And I'm also checking for the size of your internal organs like the stomach and the liver. Not feeling anything out of the ordinary. Patient does not note any pain. Okay, I'm going to go in with a little bit of a deeper palpation. Okay, the size of your stomach is normal. And I'm checking your liver. Which does not feel enlarged. Pressing down on your kidneys, patient does not note any pain. No masses are felt or enlargement of the abdominal cavity. Okay. I'm going to visually inspect the abdominal area next. My UV light is helping me detect any micro lesions, spot any areas of dryness, red patches, eyes of psoriasis. And I'm also going to inspect the belly button area. Okay, looks normal. Okay, we're going to do the same sharp or dull test. on your abdominal area. Sharp or dull?
Dull.
Good.
Sharp. Dull. Sharp. Dull. Sharp.
Good.
Dull. Sharp. Sharp. Sharp.
Good.
Dull. Dull. Sharp. Sharp.
Good. Okay. Do you feel 2 pinwheels or 1?
1.
Good.
2. 1. 2. 1. 2. 1. 1. 1. 2. 2. 1.
Good. I'm just going to measure your belly button next. Make sure that it is symmetric. 2.1 across. 2.2. 1.2. 1.1. 1.3 and 1.9. Okay. Just say yes when you feel a vibration touching you.
Mm-hmm. Yes. 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 Yes.
Good. Okay. Next up, I'm going to test the elasticity of your skin. Okay. Just seeing how much I can grab. And whether it retracts normally without any redness. Okay. Can't grab quite that much. You don't seem to have a lot of fat in your tummy. I try. Yeah, you're very fit. Thank you. Okay. Okay, that's good. Skin elasticity is as expected. No redness. Skin just bounces back. Alright, next up I'm going to do skin pulling and skin cracking therapy on your tummy to